So I'm Dr. Dusan Sajic, board certified dermatologist in both US and Canada. Neuromodulators, also known as Botox, Xeomin, Dysport, Nuceiva, lots of different names for them, are just like it says, neuromodulators. They block the nerve synapse between the muscles of expression. So when we inject it, we're able to slow down the firing of the muscle so that it doesn't flex as strongly. And the reason that's important is the reason you see wrinkles is when you frown really deeply, that puts an imprint on your skin that we otherwise call wrinkles. So by slowing the actual root cause of what's causing your wrinkles, firing of those muscles, so by lessening that, we're able to lessen wrinkles. So that's why we call it neuromodulators. That's a question we always get, is Botox safe? Because of the name botulinum toxin. Okay, so even though it's a toxin, we have to remember it's the dose that makes a toxin. So even drinking too much water, lots of examples of marathon runners actually dying. Why? Because they drink water without electrolytes. So when used appropriately, it is medicine, it's a medical treatment, and it's quite safe. How do we know? It's been around since 1989. We used to use it for what we call strabismus, or basically vision, double vision, and eye spasticity. It's been approved for that use since 1989. And then the same doctors, actually from the Carruthers wife and husband team, they discovered that, hey, when we were injecting our patients around the eye area, their wrinkles got much better. So then they pursued that for a cosmetic treatment, and that was back in 2002 that it became approved. Since that time, we're talking hundreds of millions of patients that have been treated worldwide, and it remains one of the safest treatments for enhancing your overall skin quality and also reducing the appearance of fine lines and wrinkles. Even more exciting, we're finding out just in the last few years that it has benefits beyond that, and that it can actually help with signs and symptoms of depression. Well, what areas can't we treat? It's really any area that you're finding a lot of muscle movement or strong movements or strong expressions that are causing wrinkling of the face is the areas that we can treat them. So the most common areas are what we call the 11s, so right in the glabella. We can also do the forehead, but we have to be careful. They're all connected. So if we overdo it, what can happen is the forehead can drop and the eyes can drop. So what we do is around the eyes to relax the eyes so that they can open up. Really, it's like a tug of war. If we relax here, we have to relax here as well. Those are the most common three areas. We call that the upper thirds. But the other very common areas, and one that's particularly gained interest, is the Nefertiti lift. That's what we inject through here. Why? Because there's a muscle called the platysma that as we age gets stronger and contributes to drooping and sagging. So again, remember, we call it a tug of war. So by decreasing this, all of a sudden, the face springs back up, and it's a nice non-surgical, looks like a lift. Patients tend to like that a lot. Around this area, we also call it the masseters. Okay, so if you have very strong jaw muscles, we can inject those. Helps with headache, especially if you're getting jaw pain and jaw clenching, prevents teeth degradation. That's also important because as we age, actually we lose our teeth in the jaw. So more grinding that we do, the faster we age. So another reason beyond just slimming the face by relaxing those muscles that we use the masseters. And then there's some other more niche areas. For example, we can use the bunny lines on the nose. We can do it around the lips, or we do the lip flip so that it gives you the impression that your lips are more full. So those are the most common areas. And then on top of that, we can do a micro Botox, really all over the face. We use it also in our gold protocol, where we mix it with biostimulatory and regular HA fillers to really give the full scope of skin relaxation and just opening up those pores so they're not as visible, reducing subtle inflammation. So it's great for things like boosting your acne and rosacea. So that's really the most common types of Botox or botulinum toxin treatments that we do. So the Botox itself doesn't feel like anything. It looks sort of like water. It's really the sensation that you feel when we're injecting it. So it's the feeling of the needles. If you're squeamish about needles, there's lots of things we can do, like numbing that we put on, but most people don't need it. It's a very tiny needle, the smallest possible needle. It's the diabetic needle that we use, 30, 31 gauge needles. So So generally it's like a little tiny pinch, but most people tolerate it quite well. At the end of the day, it's looking at the intensity of the muscle, how much it's flexing, and how much we need to do to not overdo it, but not to underdo it. So it's all about the Goldilocks. It comes down with experience. Often patients will come in and say, I needed this many units. You have to be careful with that. It's hard to say exactly unless they were a dermatologist. There's been several reports in the news of people actually diluting and saying you got 8 units, but you actually got 2, or who knows. And sometimes the amount we put in one area might affect the areas outside of that and how much we want to put in based on how it's all interacting. So it's really all coming together. It's like asking a chef, how much pepper exactly did you put in, basically to the look and the taste and what other ingredients are doing. So it all comes down to the balance. Every patient is different, and it's really important to get the right assessment, and that may change from time to time as well. Well, I like to say Botox is for women and Brotox is for men, but that's a bit of a cliche. No, Botox, botulinum toxin really is for everybody that's concerned about, fine lines. Top of that before it becomes very deep lines, because once they're deep, we can't erase them with just botulinum toxin. Then we're looking at things like lasers and fillers to erase those lines. So no, it's for anybody that's interested in preserving and locking in their youthful glow. As soon as you notice wrinkles, we're looking probably early 30s for most people. Unless you're a very expressive person, you're gonna maybe need it a little bit sooner. But usually early 30s is when majority of our patients come in. Like anything in medicine, whether it's wrinkles, health, you wanna get it early. As the saying goes, it's really true. An ounce of prevention is worth a pound in cure, and it's same with this. Depends on the patient, okay? So how soon we see results depends on the type of botulinum toxin that we're using, the patient, their experience with it. We have some patients that take much faster, some patients that take much longer. Generally, most patients will see some effect within about 3 to 5 days, with the maximal effect taken in somewhere between 10 to 14 days. It also depends on you and your protoplasm, okay? So the average is around 3 months. Some people can get a little bit less, some people can get a little bit more. It all depends on your physiology, anatomy, and also the type of botulinum toxin that we're using. There are some new products out there that claim to be lasting longer. I've yet to fully really see it in practice. There is some evidence in the literature that Dysport, for example, can last a few weeks longer. So that's something that we have to consider as well. It's really all about the consultation and knowing and understanding your anatomy and physiology. So how do you avoid overlooking done? That's really important to be assessed properly. So there's many different types of aging, both from extrinsic to intrinsic. So we need to address all of your signs. You need a proper assessment to see where the aging is coming from. And to address, like I said before, it's all a pulley system. So if you do one side too much and the other one not, it's going to look maybe not well and not proper, and it's going to look fake or overdone. So it's really achieving the balance and harmony and not really pushing one treatment, but looking at other treatments. So maybe it's not all going to be Botox. Maybe you need a little bit of radiofrequency microneedling or a little bit of laser or lifting with something like cold therapy, for example. It's really the combination. So I myself, as I'm nearing 50 in just the next few years, I've done all of these treatments. And my goal is always, just like for myself or my patients, to not look done. The main way you can do it, if you're not doing it with us, make sure you see one of the 4 core aesthetic specialties like head and neck surgery, facial plastics, plastic surgery, ophthalmology, and dermatology. Those are the key core groups that you want to see. Why? Because they're board certified to do aesthetic medicine, meaning the test was designed to test how well they know their knowledge. And about 20% of the test takers, even though they're plastic surgeons, dermatologists, fail this exam the first time. That's how difficult it is. So you don't want somebody that's done just like a weekend course that isn't supervised and overseen by a dermatologist or a plastic surgeon. Otherwise, you're just setting yourself up for not getting optimal results. If optimal results are important, this is what I would do. Just think happy thoughts. Sometimes, having anxiety and being nervous about needles can cause you to be a little bit more anxious and feel a little bit of that pain. There's not a lot of prep or downtime that comes with it. It's a fairly quick procedure. Most of the time, we're able to do it on the same time as the consultation because it's rather a quick procedure. So really, not a lot. Just make sure you're not sunburned. Make sure you don't have any open sores in the areas that are treated, active acne, cold sores, whatever it may be. But if your skin is looking good, it's not open, broken, or infected, generally most of the time we'll be able to do this. The main thing is also not having contraindications, like for example, myasthenia gravis, or if you're allergic to Botox, for example, or any components, that's something you would want to avoid. The main side effect for Botox would be bruising and pain. The bruising, when it does happen, it tends to be a tiny little bruise because we're using tiny little needles. Very rarely, especially around the eye areas, there's a lot of vessels there. So even though we do our best to avoid them, sometimes we can hit a little vessel and sometimes we can get a little bruise. Problem with the eye, that even a drop can cause a black eye appearance. So that's the biggest risk. The second risk is what we call asymmetry. So one side might be a little bit higher than the other or lower than the other. And so you may need a touch-up for that. Lastly, eye drooping can be a big one, especially if you don't like the heavy look. Most patients don't. So if that happens, usually we just wait it out. It will go away after 3 months, but those are the main side effects. The difference between those three, really the same as Audi, BMW, Mercedes. It's a different company that produces them. They're all neuromodulators. They're all botulinum toxins, so same molecule. Now, how they package them, how they put them together, there's slight variations. There's slight variations in terms of diffusion. I find that's mostly on the technique. That's mostly on the way they're reconstituted. So some people will put more or less volume. And based on your training, some of these botulinum toxins actually have recommended different dilutions. So it might affect the way it diffuses across, but generally speaking, they're all considered to be equivalent. It's all about the holistic nature. So one of the things that we do here is really talking to you about Botox or botulinum toxin or any other treatment that you're looking at in the grand scheme of how it affects and how it connects from, both your health and also the way you're going to look. Our goal is always an integrative, total approach where whether you're starting with botulinum toxin, we always feel that it's your right to at least know what the next steps would be if this is a suboptimal treatment, or if you're just starting out on the journey, to really tell you why you're aging, why we see these things happening, the descent, the degradation, the deflation, losing of the collagen, deeper lines and wrinkles, sun damage. It's really all about having a comprehensive assessment and giving you the right education and the right tools for you to come up with your own decisions of what makes the most sense. Sometimes patients will come in and say they want Botox, but we find out maybe that's not the best treatment for them and they're actually looking for more volume. Botox is not going to give you volume. So it's really about finding out what your needs are, what's causing you the issues, and guiding you as a team member. Really, you are our boss as a patient here. My job and my team's job is to educate and give you the best advice on what's the safest, what's the most effective, and how do we integrate them all together so that you still look like yourself, just the best version of yourself. Remember, if it looks done, it's done wrong.